Docs Innovant are the pioneers in developing innovative medical devices. The company was formed subsequent to the invention and commercialization of the iGel supraglottic airway device invented by Dr. Nasir for the human anesthesia market. With the device now being used all over the world, Dr. Nasir looked into how it could be used in the veterinary market, as no such device existed, with vets just using endotracheal tubes. However, this presented a number of challenges.
Human is one species, while the veterinary there is a varieties of species. So we had to work with each species separately to create species-specific device for the airway management in veterinary anesthesia.
The research for VGel has been extensive and very intense. Literally, whatever we know, predominantly in the human side, the few basic elements remained intact, but then we've had to completely go on a brand new journey.
We've taken the human devices, we've gone through 1.5 years of post-mortem work to take those devices and change the shape and change their function to make them suitable for veterinary small animal patients. We've then gone from there to clinical studies. Each shape change that we made was prototyped, rechecked, changed, and that process has taken several years, and until basically we've ended up with the clinical prototypes that we're using at the moment.
The materials that we've used are extremely soft, so as you insert them, they will give and they won't traumatize the tissues of the patient. Starting from the distal end of the VGel, there is a small bump on the leading edge. This locates into the esophagus, and it helps to give an esophageal seal. So if you are ventilating a patient, you're not sending gas down into the esophagus. The next piece is a dorsal raised area which fits into the pharynx, and in the cat version, you also have a small dorsal inflatable button or cuff, which when inflated, gently increases the seal pressure around the perilaryngeal area. A super soft, anatomically designed, shaped cuff that mirrors the anatomical landscape of the peripharyngeal larynx, thus providing a snug fit that gives clinically effective seal pressures. You've then got the airway channel inside the device. That's been designed so that it is the same or greater diameter than the trachea, and you get no narrowing of the airway the patient breathes. Further on, a small notch fits just behind the base of the tongue. It helps to stabilize the device and prevent it rotating or pulling out of position. The shoulders of the device locate onto the pharyngeal arch or glossopalatine arch on insertion. They will just press on the pharyngeal arch and then rebound gently backwards. This gives the user a very positive stop point so that you can tell when the device has been inserted to the correct depth. On the ventral side of the device, there is a hollowed out area. This reduces the pressure on the base of the tongue and helps reduce lingual cyanosis. And then moving up, there is a dorsal bump or ridge. This fits into the hard palate and helps reduce rotation and increases stability. Towards the connector, we've molded small ridges into the device and a connector with integral tying in points. This gives you alternative options to get the most secure hold when tying the VGels in place. The connector runs inside the VGel to provide protection against a patient accidentally biting through it. Attached to the connector, there is a gas monitoring port designed for easy attachment of a capnograph.
Because I'm using a soft device rather than a relatively hard endotracheal tube, that will reduce the risk of trauma, and that's also going to increase the patient comfort. And we see that in the recoveries. We get much more comfortable recoveries without gagging, without coughing. For inexperienced staff, they're finding that the VGel devices are both much easier to insert because they're not having to worry about the risk of laryngeal and tracheal trauma. They're also finding that the recoveries of these patients are smooth and nice, without gagging and without coughing. It's been a lot of fun. We've developed a completely new method of airway management so that vets have different options rather than the normal endotracheal tubes, which is all we had before.
A rabbit or a cat or a dog or a horse is alive. So is the human. So they have to be treated as similarly as the humans are treated. And if we can bring that level of safety into the airway management, into the veterinary, that makes the difference of saving lives.